We want to thank everyone for being here this afternoon and are really, quite frankly, sad to be here. But we feel like it's necessary as supervisors of the city, of supervisors of the neighborhoods that have the most homeless people sleeping on the streets and in navigation centers, that it is time that we speak out publicly about our city policy around people experiencing homelessness during the COVID-19 crisis. We received news today that for the first time that we know of, someone tested positive who was sleeping behind me at the Division Circle Navigation Center. For the past 4 weeks, the five of us as supervisors and Jennifer Friedenbach, the executive director of the Coalition on Homelessness, has been talking to the Department of Public Health, to the Department of Human Services, to the mayor's office, and saying, from a common sense perspective and from a health perspective, we need to house in hotels, in some of the 30,000 plus hotels that are sitting empty as we speak, people experiencing homelessness, if they can take care of themselves in the hotel, if they don't need supervision 24 hours a day. We have the hotel rooms, we have the money, we have the staffing. Why wouldn't we do this? Why wouldn't we do this right now and save thousands of lives? For 4 weeks behind the scenes, we have been advocating every single day to do what can only be called common sense. And we have been given every excuse in the book about why this isn't possible. Well, we are here to say this is possible, and we are not going to take no for an answer. This morning, we demanded that everyone from this shelter who has been exposed to COVID-19 be housed in a hotel room if they can take care of themselves. We were told that that is not going to happen, that they will move people that were sleeping closest to the individual, but that they weren't even ready to move 60-year-olds or people with serious underlying health conditions. We know that there are at least 75 individuals who are over 60 or who have serious underlying health conditions that have been guests in the Division Circle Hotel and must be moved today. Supervisor Peskin will share with you a conversation he had with the mayor a half an hour ago. It appears that they are going to move individuals that are older or have health conditions by the end of the day, but not everybody in that navigation center. And what we're here to say is that is simply unacceptable. This is my district. That navigation center sits in my district, and I will fight to get every one of those residents, like all of my constituents, inside, sheltering in place and safe. Once again, we have the hotel rooms, we have the money, we have the staffing. We can fight for more money from the feds if we can't pay for it all at once. Why aren't we doing what makes sense and saving lives by housing every single homeless individual who can shelter in place and self-care? There is no reason and no excuse why we cannot be doing that. I will now turn it over to the executive director. Sure. My name is Hillary Ronen, Hillary Ronen. I am the supervisor of District 9, where we are standing right now. We called it collectively. The five of us supervisors, Supervisor Aaron Peskin, myself, Shaman Walton, Matt Haney, and Dean Preston, who is on his way, have been fighting and making this very demand for the past 4 weeks. We think we've gotten somewhere, and then we move way backwards. We think we've gotten somewhere, and then we move way backwards. So we are now taking this fight public, and we will explain all the steps that we are going to do in order to do that. We're going to introduce emergency legislation that my colleagues will talk about shortly. But first, we're going to introduce the executive director of the Coalition on Homelessness, Jennifer Friedenbach.
I am I'm Jennifer Friedenbach. I'm Executive Director of the Coalition on Homelessness. Paul told me to speak loud, so I got a loud voice. You know, we knew this day was going to come. We have been talking about it for weeks. We've been saying we got to move everybody who's unhoused off of the streets into these empty hotel rooms. We have been having folks out on the streets tell us that they feel like the city is just leaving them here to die. And the response from the city is, well, we don't have enough support services inside the hotel, so we're not going to move people into those empty hotel rooms. Well, people aren't getting services on the street now, so what exactly is the difference here? Why would you leave hotels empty? Why would you allow thousands of San Franciscans to sleep on top of each other every night? Tonight, we're going to have thousands of people inside shelters in overcrowded conditions. They have not been moved yet. They have not depopulated the shelters. They are still packed. They are still sleeping in some situations about a foot apart from each other. So, we're incredibly angry about this, and worse, we're really afraid. When we're talking about the homeless community, what we know is that they appear medically 25 years elder their calendar year. That means as a 50-year-old woman, let's pretend I'm 50, I present as a 75-year-old woman medically. Higher rates of heart disease, higher rates of diabetes, all the underlying conditions that we're talking about in terms of age. That means that if I contract the virus, I am at risk of dying. And yet, for weeks, these hotel rooms have been sitting unoccupied while we're putting people's lives at risk. And these are also folks, I want to remind you, that are most likely to end up in the ICU. We don't have that many ICU beds in San Francisco. That's been the fear. So all of us have been practicing social distancing. We've been practicing shelter in place. Well, if you don't have a shelter, you can't shelter in place. If you're living in a congregate setting, you cannot practice social distancing. What that means is that we have a double standard in San Francisco, where based on your economic status, you were allowed or not allowed an opportunity to practice what the health department is asking all of us to do, and that is not okay. So we are asking that everybody that's out on the streets, that everybody that's in congregate shelters be moved into private rooms right away. We could also move folks in congregate settings out of SROs. The city is saying that they are going to move vulnerable people out of the streets, shelters, and SROs. They said last week they'd move the people out of shelters and SROs, and the week before out of shelters. We have not yet seen it. So don't be fooled. The same situation that existed at the beginning of this outbreak is the exact situation that unhoused people are faced today. And that is absolutely unacceptable. Thank you.
Good afternoon. My name is Supervisor Shaman Walton, and I am here today to talk about the disgust that we have with our Department of Homelessness and Supportive Housing, with our Department of Public Health, with our Department of Human Services. We have been trying to work together behind the scenes with that leadership of the city to address the issue of our unhoused population and making sure that we get them out of congregate settings immediately. As we talk about this virus, we knew when we get to this day where someone at a navigation center or at a shelter or living in an SRO or other congregate settings would contract the virus. We have been trying to be very preventive so that we would not be in this place. Our shelter-in-place order is in place so that we can prevent the spread of COVID-19 and keep people safe and protected. There is no way to adequately enforce social distancing and ensure that people are spending enough time apart and there's enough space in between people when they are in shelters and navigation centers, SROs, and living in encampments. And therefore, we have worked hard to push the leadership of the city to house our unhoused population in hotel rooms where they could be isolated, sheltering in place safely, and away from exposure and away from exposing others. Now, this is not just a bunch of supervisors getting together, being upset, trying to fight for publicity. In fact, yesterday's press conference, you heard from our executive leadership, you heard from leadership of our departments. We secured 6 hotels with 479 rooms. And we also knew that there were 2 other hotels added to the pot that had 570 plus rooms. That's over 1,000 rooms that we've already secured as a city. According to the press conference yesterday, 130 or so, less than 130, where we had individuals placed in those rooms. So that leaves about 800 plus rooms for us to make sure that people who are unhoused have a place to go. Now, in terms of our navigation center here at Division Circle, we know the capacity is 180 plus. We know that one person has contracted the virus. That means that everyone should be placed in a hotel room, isolated, and everyone who was around this individual should be tested. Our goal is to make sure that this does not spread throughout here in San Francisco, and that goes for our most vulnerable populations who are more likely to be exposed to the virus. So we are going to continue to say to our executive leadership, to leaders of our departments who are responsible for protecting our homeless population, that we need to get people in hotel rooms and isolated. We cannot say that we have a shelter-in-place order, that we don't want people spending time in settings with more than 10 people, but continue to encourage congregate settings, continue to say that we're going to put more vulnerable populations together and increase the opportunity of people becoming exposed. We are calling on making sure that these rooms that we continue to secure are also available to our unhoused population, which is very vulnerable and susceptible to contracting the virus. That is how we keep everyone in San Francisco safe. That is how we keep our unhoused population safe, and that is what we're going to continue to fight for. We do not want to get in a position. We know where the chunks and the largest populations of our unhoused population live in San Francisco. Districts 9, Districts 10, District 6. We have SROs and large people living in congregated settings in District 3 and other vulnerable populations also in District 5 and other areas of San Francisco. So we have a responsibility to make sure that this virus does not spread amongst our unhoused population, just as much as we have a responsibility to make sure that this virus does not spread across San Francisco as a whole. So we're going to be fighting to make sure these rooms are secured. There's legislation and other things that we're going to be doing within our power as a Board of Supervisors. And I'm going to stop and bring up my colleague, Supervisor Aaron Peskin.
Thank you, Supervisor Walton. And let me just start by saying a number of words of thanks. First and foremost to the people of the city and county of San Francisco who have been doing an extraordinary job, all of whom are suffering in different ways, and I think we all understand that. I would like to thank Jenny Friedenbach and the Coalition on Homelessness for their incredible leadership, as well as my colleagues. As Supervisor Ronan said earlier, in no small part due to the pressure that the board has continuously been bringing after the terrible news of this morning where one individual was diagnosed with COVID-19 in one of our navigation centers behind me. The city, and I spoke with the mayor about a half an hour ago, is picking up the pace. Anybody in this facility who is near the individual is going to, or already has been, moved to a hotel room. That will be the case by the end of the day for anybody in this facility over 60 years old or who has underlying complicating medical conditions. So I want to thank the mayor for that. We are going to be judged by how this government and how our people behave during this period. We have a moral imperative. Some of us, like me, can go home and self-isolate, but many people in our SROs, people on the streets, people in our shelters do not have that luxury. History will judge us on how we dealt with that population, which is why what me and the other 4 supervisors are doing is such a deep moral imperative. I really want to also thank the media who's coming out here and being brave for your constant communication with the people of the Bay Area and people around the world. Thank you for what you are doing. And to that end, I think that the city of San Francisco and the region really need to pick it up on the side of transparency. Right now, all we do is we tell everybody how many confirmed cases there are and how many deaths. We need to become much more transparent. We have the ability to do that. We have the information. We live in the most technologically rich part of the United States of America. We can step it up in the same ways that New York has stepped it up. We should know how many tests have been administered, whether by public or private health hospitals, whether those test results have been negative or positive or inconclusive. We should know how many people are in ICU, not only at the General Hospital, but across all hospital systems in San Francisco and the Bay Area. We should know what our capacity is at those hospitals. We should know the same thing on the hotel side. How many hotel rooms are out there? Well, we know that there's some 35,000 hotel rooms out there. We've got to pick that pace up, and the public should see those numbers every single day. The media should have access to those numbers. There's no reason that in a democratic society we should not be transparent about those numbers, and I am calling on the mayor, our Department of Public Health, and our other departments to do that, and I know I'll be joined and supported in that by my colleagues. Thank you, everybody, for hanging in. This is a tough period, but together I know we're all going to get through it. Thank you. And with that, I'd like to bring up my colleague, whose district is just across the street, Supervisor Matt Haney.
Thank you all, and thank you all for being here. I'll be the last speaker. Matt Haney, Haney. I represent District 6, right on the other side of the freeway here. Very sad to find out today that we had our first COVID-19 positive case in one of our shelters and navigation centers. And this is something that was preventable. This did not need to happen. We should not have hundreds of people in congregate living environments literally sleeping right next to each other, brushing against each other, when we know that's exactly the type of environment where this virus spreads. This is common sense. One of the first things that we did when we declared this emergency, when the mayor declared this emergency, she banned large gatherings. She said, stay at home. Our city told everyone who can to stay, especially if you are vulnerable and older, to stay at home completely. Only go out for essential things. And yet we continue to have people who are under our care, who are in our shelters, who are in our navigation centers, who are in these large environments with hundreds of other people who are vulnerable. This has to end. The people who are in our shelters and our navigation centers who are vulnerable have to have access to the tens of thousands of empty hotel rooms that are available in our city. The fact that this has not happened has put hundreds, thousands of people in danger, not just in our navigation centers and shelters, but also all San Franciscans. Housed San Franciscans as well should be deeply concerned about the fact that we have not taken action to prevent the spread of the virus among people who are unhoused, because that is going to affect the public health of our entire city. What we are asking for, what we are demanding, is right away for everybody at this navigation center to be able to have access to testing, every single one of them, for all of them to have the option to go to a hotel, to be able to be quarantined, and to be able to stay at home, and to immediately expedite a plan to move vulnerable people from our crowded, unhealthy shelters and navigation centers into hotels. This is something that every San Franciscan who's walking outside and looks around and sees people out on our street, thousands of people out on our street and in crowded shelters and navigation centers know that this is wrong, it's dangerous, it's unhealthy, and we have a solution, which is to actually get people into hotels. We've introduced emergency legislation, which will be introduced on Tuesday, that will push this, that will require this, that will require us to secure the rooms and get folks inside. But it doesn't have to wait that long. It doesn't have to wait for our legislation. This is something that the mayor can make happen right now, and we are here to work with her, to work with the public health department, to work with anyone to help secure those hotel rooms and get folks into safer environments right away. So I want to thank you all for coming here. I want to thank Jenny Friedenbach. Is there anything more that you want to say, or and we can answer questions? Sure.